Let's start now. And so, Assalamu alaikum, everyone, and good morning, good afternoon, good evening, depending on where you're joining from, various time zones. We know that we cross multiple continents and multiple time zones when people are joining. And this is thanks to the technology. And while I'm saying thanks to technology, I must acknowledge the technical team behind these webinar, which is Waleed and his team, who has been um, making sure that everything goes effortlessly and seamlessly without any technical issues. And they've been working behind the scenes to make sure that we have these webinars. And then not only that we are having these webinars, they also make sure that we get the YouTube and all the transcripts and everything done in a very timely fashion. So once you are done with these, once we are done with the live session, you can always go back, or if one of your colleagues who has not been able to join, they can always go to our APPNA YouTube channel, and then they can listen to all these talks later on for an encore presentation. So with that being said, just formally welcoming everyone for the um, yet another in series of the APNA webinars, which is the this Association of Pakistani Physicians in North America, Medical Education and Research International Training and Transfer of Technology webinars, and we do these every 2 weeks on the same place, same time, where you've been joining again. I'm your moderator. My name is Sarfraz Hasni, and I'm a physician scientist and rheumatologist, director of the lupus clinical research at the National Institutes of Health in Bethesda, Maryland. And I'm joined by multiple panelists today. So our Dr. Saeed Al-Ghani, who always joins us, is here as a panelist, and then Dr. Jabin and Dr. Sarwat Hussain and Dr. Akhtar are here, who are also panelists. So our pattern is that we will ask the speaker to talk for 40 to 45 minutes, and after that, we will ask the panelists to share some of their comments or commentary on the speaker, and then we will open it up for question and answers. For any question and answers, you can put it in the Q&A tab, which is at the bottom of your screen, and we will try to get to as many questions as possible. But if you're not able to get to questions, you can always ask them offline. So with that being said, it's my distinct honor and pleasure to introduce today's speaker, who's Dr. Shakeel Ahmed. Dr. Shakeel Ahmed is a professor of pharmacology and clinical sciences, currently at the American University School of Medicine in Aruba. He has he's been in education and of teaching international medical graduates for more than 15 years in Canada, preparing them for the Medical Council of Canada qualifying exams and also for the USMLE. He has taught in various institutions and facilitated the University of Toronto students for their OSCE examination. In his clinical part, he has done teaching in basic science, medicine, surgery, pediatrics, behavioral science, and he has been part of clinical practice guidelines, and he has done a lot of computer and and interpersonal skills for communication. So just doing a lot of soft skills that are needed for success in our career. And then he has been he's been a graduate of the Dow Medical College in Karachi, and he did a post-graduation in pediatrics from the College of Physicians and Surgeons in Pakistan and University of London, and then he was in Saudi Arabia, and finally he moved to Canada in 2008. So he has a very long list of accomplishments, but I think uh, you're all waiting to listen from him and want to see what he has to tell you about the landscape of medical doctors, opportunities and challenges in Canada. So with that brief introduction, I would request Dr. Shakeel Ahmed. And first, thank you so much for taking time. I know you're super busy, but thank you. So Dr. Shakeel Ahmed, please take it away.
Hey, Assalamu alaikum, and thank you, Sarfaraz, for all your comments and description. Very good afternoon, everybody. I'm sitting here, Aruba, 30 degrees Celsius in my room. And this humble presentation I understand that a lot of questions, lot of queries, lot of details, but I will try to summarize just the guideline for the medical uh, graduate who intends to come to Canada and they want to practice the Canada. Before I start, I must thank Dr. Uzair, who is a very good friend of mine, and he encouraged me. Thank you, Dr. Uzair, and really, what he is doing is commendable and very nice. So we started, and just a few points. This is dedicated to all young medical doctors and graduates and experienced physician. I've included a lot of parallel pathways as well, a couple of slides. But what I felt during my teaching that what are the problems in the IMG. So I have divided the problem, the challenges, what we call, into, I hope everybody can see my whole slide and you can see me. Is it okay?
Yes, yes, we
Okay.
can.
Okay. So the challenges mostly we have most of the time IMGs, what we call international medical graduates, they have a lot of challenges. Four are the topmost. Number one, the cultural shock or sensitivity, and then financial constraints, professional and then exam taking skill. These are the four major problem why the IMGs they are on a lower side of the scoring system once it comes to the residency program, why they cannot enter into the residency program. The IMG, it can be a misleading terminology for some of you because, because I'm in Caribbean, and for the last 3, 4 years, I'm working in Caribbean, and here we prepare the for the US only exam. And can you believe that the US exam, the IMGs from Caribbean, about 75% are coming from Caribbean. So that's amazing. And that's the one reason you will see in the data slide that why the IMG's weightage from the USMLE program is much higher. Unfortunately, in Canada, there is no such training system. And therefore, they are just new landed immigrant and they have a lot of problem with their families and the other thing. So sometimes we have difficulty, the IMGs have difficulty. That's in the introduction. So as I told you that the IMGs, they have cultural shock, they don't understand the North American culture or Canadian sensitivity. They have difficulty in adopting the norm, language, weather problems, communication skills. That is the third point is very important, and I will advise all my students and the doctors who are coming, uh, please go through, especially for the OSCE examination, because I was one of the simulated patient in the University of Toronto examination, and I learned there that it is the language and communication skill, not the knowledge. You all are knowledgeable, but if your language and soft skills are not very good, then probably you will not score high. Similarly, the last point, it's a little painful, but it is true, and you should be prepared for it. So the students are coming from India, from Pakistan, from UK, USA, and the other part of the countries. They have different culture and different norm. Financial as well, that because they are mostly in Canada, if you are talking about today, I will focus mostly on Canada. So they are focusing on their family settlement, and that affect their studies. So that is the one of the factor. I remember that one of my student, uh, he was, and his family, they both, like the husband, wife, and the children, they were new immigrant. They were from Lahore, and the husband was orthopedic surgeon, and the wife was FCPS in gynecology. Both were trying to get into the Canadian. And they were, I was their mentor or teacher, whatever you can say. Husband was driving a cab to meet the expenses of the family, and the wife was doing. And the to cut the shorty, like the story short, uh, husband cannot do, but the wife did. And now, mashallah, she is having the practicing license, and she is working as a consultant OBGYN. So, like, don't be a lot of students, they are doing the odd job. Don't think that you cannot do. You have to look after your family. You have to look after yourself. But at the same time, please focus. You need at least 1 year, 1.5 year. Don't rush for your examination. Okay. Some of the financial can be regarding the OSAP, that is only given for the registered program, day program, full-time program of the university. So the diploma courses or short time, sometime you won't get the OSAP. Before I go further, one thing should be very clear, because I found that some of the inquiries are coming. Can we come to Canada? Well, the answer is yes, you can come, provided the citizenship government of the Canada, it allows you. If it does not, but you don't have to write any exam of the Canada, because simply you cannot practice. In Canada, if you want to practice, then you have to be citizen of Canada. It should be very clear that without a Canadian citizen, you cannot practice medicine in Canada. So make sure, and that is another pathway. The pathway is Canadian Immigration and Citizenship, CIC. That is a different, it has nothing to do with the Medical Council of Canada. Okay. And similarly, if you are not Canadian citizen, you are not eligible for OSAP as well, or the other program, for example, Atlantic Immigrant Career Loan Funding Program and the other programs. We also see that there are some professional gap. Those who are coming from India or Pakistan or Bangladesh, or uh, some uh, institute in the other part of the like Arabian, or even African student, or Chinese. So number one, recency of practice. We advise that you're earlier. So there should be no gap more than 3 years. More than 3 years doesn't mean that you cannot write the exam or you cannot get the residency. You can, but you have to be very sure that earlier is the better. Younger graduate, they have much chances to get a residency interview called. English language, and you should be well familiar that what are the phrases and what are the medical terminology, professional language, critical thought process. Uh, it does lack in our students. Their education based in memory. Well, memory is good, but can you figure out that how to solve this problem in the triage area, or, for example, in your office? If you cannot think of that management, believe me, the Canadian exam are the management exam, whether it's a MCC QE1, whether it's a CDM part, whether it's a OSCE. If you lack the critical appraisal, then you have much difficulty in passing the exam. There is a gap in the basic sciences. Since I came here for the US student, I felt that our students, they have some difficulty in the basic science, and they also have the problem in the data interpretation, the lab, or the other data. They know that these investigation, but what about the interpretation of those investigation? Do you understand that DEXA scan? What is the meaning of -1.5? T score and Z score. So that how you communicate these things to your patient. Okay, so they will assess you this in OSCE as well as in your question. Ethical and the clinical practice guideline. Why I wrote together, because it's ethics. Clinical ethics is different than the ethics in the US. At some point, maybe 80% same, 20% different. Okay, and the behavioral sciences. So that including the psychiatry and the problems, especially the screening program for things like depression. Our student, they need to focus on. They have sometimes they are not familiarized with the pharmacological preparation and their side effect, a common side effect, and then what to do with the patient if the patient comes with the, let's say, sexual dysfunction, then how to switch, which drug next, so that they don't understand that this is something you should focus in those points. Similarly, the epidemiology, biostatistics, and the other, there are some indirect question. Calculation question in the exams are not too many, maybe two maximum or three, and simple one. But the concept of the epidemiology, for example, what is the prevalence, what is the incidence, what is the how the duration of the disease affect, and so on. Now, examination taking skills, they are normally prometric, and there is a lot of things. You need a proper guidance to exposure that how the exams are conducted. You should be very well aware about the technology of the like the laptop screen. You should be able to calculate, open the calculator, do review the lab result, because if these are given, and how to increase the font of the picture, images or ECG, sometimes they will give you. That's number one. Second is the resources of the exam. We keep on, uh, you know, very fond of just storing up a lot store of resources, but what to study, what not to study. Dr. Shakeel, we should study Toronto Note? How much we should study? Do I need to go through the Katrina OSCE book? What about the Edmonton manual? And so you should be very focused and precise. Some parts are important, some parts are time management, especially for the computer-based examination. Time is about 1 minute, 10 seconds. Good news for the IMGs, uh, like April 25, they are going to abolish the CDM part, and they are going to increase the timing. I guess now normally it is 75 seconds. They will increase to about 80 or 85 seconds. I'm not sure, but you can check on the Medical Council of Canada website. And that changes will be effective from April 19, 2025. Computer skill, as I explained you, the calculator usage on computer, online, please practice at home. Communication skill, as I explained, the NACOSCI examination, that is a practical examination. There is no, nothing like that video. There is an examiner and you are there. Sometimes there could be some nurse as well. Lack of Canadian hospital exposure. There's something I also feel sorry about the fellow IMG and myself as well, that we cannot. In US, you can do the rotation, elective rotation. But in Canada, unfortunately, there is no possibility. Make sure that in your home country, you get enough hospital experience. That is the important point. And in the Canada, try to do the volunteer job in the hospital. Try to involve with some clinic. Try to involve in the some place, deal with the lack of exposure to the medical journal, MCQs, STEM, word, keywords of the question, lack the lead in line, and the critical appraisal I explained you. These are some of the examination. Now coming to the next point, and what is the pathway to the license? How we can get the pathway to the license? So first of all, you have to check where you are living in Canada. It's a big country. So we have MRA, or Medical Regulatory Authority. And as I explained you, the bottom line that you must be a Canadian citizen. That's important. Although you can write MCC QE1 before coming or before getting the citizenship. However, you cannot get the license. So license is related with this point. Check your local, that which is your medical regulatory authority, MRA. I have given in the presentation some of the local in different provincial, that in Alberta, British Columbia. For example, if you are in Ontario, then the College of Physician and Surgeon will give you the license, okay, to practice in this one, College of Physician and Surgeon, Ontario. And similarly, you can look in the other. Certification is different than the license. So certification bodies are different. And the most important certification body here is the Medical Council of Canada, which certify the general IMGs. So physician with the, and you will get, once you pass the QE1 exam and QE2, QE1 and QE2, then you will get the LMCC. However, QE2 is not required for your residency application. So it's a different two point. Okay, so for the license, you need to uh, pass. U means IMGs plus CMGs, both they have to get. And the Medical Council of Canada, it direct and it certify both Canadian medical as well as non-Canadian medical. College of Family Physician, if you want to practice family medicine, then you need to pass the College of Family Physician. Otherwise, you don't. Royal College of Physicians and Surgeons, it certifies residents who complete their program in their specific any other apart from family medicine. The IMG have the maximum chances to get residency into the family medicine. Their family quota is much higher as compared to the other specialty. Medical Council of Canada, it is the main body, and it ensures that you all are valid, and it conduct all examination, as I explained earlier, qualifying one exam and qualifying two, and then it issues the license. And that license is not necessary. It is necessary to practice in Canada, but it is not necessary for the residency program interview. For the residency program interview, uh, apart from citizenship status, you need to pass QE1 and NAC. So these are the two major exams you need to pass for the residency application. So your residence permit or your nationality or passport, number one. Number two, pass QE1 and NACOSCI minimum. If you can pass QE2, that's fine, but it is not mandatory for the residency application. And then you can apply for the, and recency of practice. Earlier, the better. Some province, they can, so COMS application is for across the board for all Canada. But for the provincial program on your PRA, so provincial program, you can, so they have their own requirement. For example, SIPA program for the Saskatchewan, they may require TDM assessment, or some program, they may, Alberta program, they have different, and they may require the language, IELTS score and so on. But the COMS is different. So this is the LMCC. As I told you, the LMCC is granted by the Medical Council of Canada, and it is by QE1 and QE2. Uh, can you get license? Yes. Number one, you pass both exam and then postgraduate training and require medical credential, and then you will get it. To get LMCC license doesn't mean that you can practice. Although it's not the other way around. Like for the practicing, you must get it. But LMCC license, a lot of IMGs, they have the license, but they are for the practicing, one prerequisite is still missing, and that is the residency program. So for the family medicine, which is the shortest 2-year residency, that is required. Without that, one cannot practice in Canada. Or for the other specialty, for example, anesthesia, radiology, surgery, they have the different length of the residency program. So apart from this one, you need residency as well. That's why the residency interview and residency match, that is much bigger achievement as compared to the other things. Okay. NAC exam is also very important, and you need to know about the NAC. There is a website, and you can go in detail. I have limited time, so I'm not explaining you. NAC is basically practical, and it tests the knowledge, skills, and attitude toward the uh, patient encounter before to residency program. If somebody has not done it. I have gone through 2 slides I made last night, basically improved last night, the NAC scoring system and QE1, and I think you will you like it, that how they score these your performance. College of Family Physician is basically certifies those who want to practice in family physician, residency in the family physician. So it certifies the family physician program. Royal College of Physicians and Surgeons, they basically certify who completed the other residency program. So if you are a member or fellow, then it is designated like the FRCP or FRCPS. Now, the licensing body in here is the College of Physician and Surgeons, Ontario. For example, in Ontario, licensing body uh, is different for different provinces. For example, in this one, it is Ontario, and the College of Physician is the main licensing body in our province, Ontario, and it is mandatory that you must have the license to practice before. And if any complaint or any disciplinary action is required, it is basically taken by the college. Uh, Simple uh, one answer: report to college in ethic question. So report to college means report College of Family. I'm again saying family. College of Physicians and Surgeons of Ontario, for example, that's the relevant college. Okay. Uh, Now, what are the Canadian standard? You should know the Canadian standard, that what are the main prerequisites. So degree, number one, LMCC, number two, residency program, number three, and then the Royal College or family physician, depending upon your residency program that you are licensed to practice there. You are certified by those one. For the Quebec, in the French, the Canadian exam you can write in English or in French. Now, coming to the what about the pathways, a lot of slide, a lot of presentation. I will go just briefly that what are the routes. There are 2 routes, CMGs or the Canadian Medical Graduate. That is those who are from McMaster or Western University or University of Toronto. So that is the Canadian, that's the local. And then international medical graduate, those medical graduate, for example, boy is Canadian, but he could not get medical admission in, let's say, in University of Toronto or McMaster. Then that Canadian boy or girl goes to, uh, let's say, Pakistan, or goes to Caribbean, or any other in the Ireland Medical College, then that is also called international medical graduate. So you should be very clear that Canadian medical graduate is not by the nationality. Canadian medical graduate means that those who are the medical education and training in Canada, irrespective that what are the nationality. So don't confuse with these 2 points. So there is a lot of things I'm going to explain you that what are the IMG's pathways. So number one is the step is that you search your medical school. Uh, as we are talking about the second route, IMG. So which medical school? Let's say if you have done from the Caribbean Ross University, or you have done from Dow Medical College, then make sure that your medical college or medical school name is university name is in their WHO directory, or it is not in the FAMER. So make sure that you go online and check. Second, you need to create a account, and it is just everybody can create an account, and you have to pay some fee and then create an account. So all the result, all the the exam booking and everything will be through your personal physiciansapply.ca account. Some provinces, they required the language test, and IELTS is the most popular uh, we get here in Canada. It is not required for Ontario or those where you give that our language of instruction in our back home institute, they are in English. But sometimes, especially the student from Iran or Arab countries, they have the problem in the language, so they need to pass the IELTS examination. There are different level. I think 7 band, and it should be, I think, academic or general. So that is the. Then source verification is done, that your diplomas and degrees, although your college has recognized, but your degrees are original, they will send directly your transcript and credentials to the school you are qualified from, and then they directly, and you just have to upload, and it is the job of the Medical Council of Canada and source verify. Okay, so that is it is also done for the ECFMG US student. What are the credential, your degree or diploma, transcript, any internship document, postgraduate, specialty certificate, or any license like LMCC license, that is also included, that one. There are certain fee, and one thing is here I should mention, because that is also a very common question the student and doctor ask, that we don't have money. So this is not an excuse. If you don't have money, then you should not go for a very, a very high profile job, $300,000 salary and all these things kind of. You should have some money. Some investment is required for every business. So please make sure uh, I will very safely can tell you that approximately 20,000 Canadian dollar are required. So IMGs should be prepared for that amount of money. Everything is going up. You need to enroll in program, in some practice session, training program, for example, Kaplan, books, examination fee, then support your family and a lot of things. And you need the money. Make sure that you go to the website to get accurate. Then coming to the examination. So the number one is the QE1 examination. The detail I'm not going because Dr. Sarfraz gave me a very limited time. So I will, if anything is left, no problem. I will do. So 210 MCQs in 3.5 hours. So that is uh, and the detail I will explain you. But important is that the health, the promotion, and the preventive medicine, acute scenario, the triage scenario, or the chronic, or the your day-to-day family practice, and then behavioral sciences. So these are the major, they are assessing you. And you can see that in the acute and chronic, the common, there are 65% question will come from here. And if you go to the score interpretation, you will see that this gray is basically the mean of the, and if you pass, then you can see that in every discipline, what is your score? This is basically the mean score, and this is the standard error of mean, or the confidence interval. So that is the health promotion and acute. So you can see that you are good, for example, in the chronic management, but probably you need more effort to match to this band for the health promotion and illness prevention. The results are given in a distribution, the range 100, so 100, and then 400. So that is called range. And there is a mean value 250. And suppose if your score is 256, so it means that you are about not up to one standard deviation, but up to approximately here sometime. So 256 score is between 250 and 280. Okay, so that you remember that passing score is different. So mean score doesn't mean passing score. Mean score, the passing score is 226, and you score 256. It means if the standard deviation is 30, so 226 plus 30, it becomes 256. So you are one standard deviation beyond passing score, not from the mean score. Okay, so make sure that the mean score is a different score, and the passing score is a different score. I will just quickly go to the NAC exam. And in the NAC exam, if I will go to the same, basically the graph, if you will see, then the range of NAC result, the MCCQ1 result is between, range was 100 to 400. So this is the minimum, and this is the maximum, and this is the mean score. Now compare it with the NAC exam result. So this is the sheet, how you get your. So the interpretation in the standard normal bell type of curve is that the range is different here. It is not 100 to 400. It is 500 to 700. So 500 is lowest, 700 is the maximum, and the mean is 600. And what was your score? So your total score was 600, and you pass. Congratulations. It means that where you stand. So if you look here, then you stand on the mean. Okay. While that score for the QE1, you were about one more standard. So your position was here, and here position. And again, see that the passing score is less than mean. Okay. So it is 575. That about the, then there are some other program like practice ready assessment program. Then we have the same program in the Ontario. You will get all these my presentation and the things in the recording, and you can go like these topics. And then TDM, as I explained you that in the Saskatchewan program, they want that, do you know about the medicine and how to prescription of medication, and what are the side effects, and what are the pregnancy issues, drug interaction. And then we have the international residency program for those who are qualified from England, Australia, or the other, so they can be given temporary license until unless they pass
Dr.
the
Shakeal,
QE1 exam.
ex-
Yes,
excuse
yes,
me,
Dr. Safra.
please go into detail. Do not worry about the time because we have a lot of participants. So I'll request you to go a little bit 5 or 10 minutes over. No problem, please. Please
Okay,
proceed.
okay. Thank you, sir. Because I was going in the rush because I wanted to explain our doctor that how the exam and the scoring system work. and they have difficulty in understanding those ones. Anyway, so these are the, I will just go, the scoring system I explained you. I will go to the practice ready assessment program, and that is the accelerated pathway for the IMG who have already completed their residency and practicing. So they have completed the residency, accepted in Canada from their back home or abroad. And there are not all the provinces, only 9 provinces, they are running this program. That's why we call it provincial program. We don't include that program into the COMS. We include this as a provincial program. Okay. There are more detail about it, but I think at this point it is just remember, because it's one of the parallel pathway, not the COMS pathway. And we also have this program, Practice Ready Assessment in Ontario. We call it PRO program, not PRA program. So PRA is basically the Practice Ready Assessment, and PRO is basically the Ontario program. Okay, so the same thing, and they have completed the clinical work. And uh, Touchstone Institute is working with the government of Ontario and the College of Physician and Surgeon Ontario, and they both they are working with the international medical graduate, those who have, for example, MRCP or FRCS, and they are coming to the Canada and they want to practice like a surgeon. What you can do? So the PRO program will help in Ontario. TDM program will help in the other provinces. Saskatchewan, I give you one example. Uh, Alberta has the highest intake. Ontario has the lowest intake due to the saturation of the doctors. Although the population is more, we still need the doctors, but the saturation is there. Therefore, so the Saskatchewan program, therapeutic decision making. So it is not the clinical decision making. It is a therapeutic decision making. What is the therapeutic? Uh, the therapeutic is the art of curing the disease. So therapeutic doctors, we are not pharmacists. We are doctors. So we practice therapeutic. We don't practice pharmacology. The job of doctors is practice. So can you practice it? Can you select the appropriate according to the sign and symptom? If yes, then you are a good doctor. If you cannot decide that, oh, doctor, I have the problem with this medicine, what I should do, and if you don't have the answer to that question, it means that you need to improve your therapeutic skill. The Therapeutic Choices is a wonderful book. It's a very big book, but I always enjoy reading that book. And it is available in Canadian libraries, all the Canadian libraries. The latest edition is available. International residency program, and they are the program for the other, for example, the other province, for example, the Quebec as well. Okay, fellowship. Dr. Uzair informed me that we have a special session on the fellowship program. So I will include the all parallel program, especially the fellowship program in that, because fellowship is also an specialized program. QE1, QE2, plus some abroad qualification, FCPS or MRCOG. Basically, that can qualify you, and there could be the other requirement, like what are the requirements. It is written citizen license, and then sponsor note. Sometimes they need sponsorship for the fellow, and then they have passed the exam. Now coming to the last part of my presentation, the match. As I told you, that having the LMCC license is not enough. You need to apply for the residency, and the COMS is the major organization which national Canada, which accept the for the residency program. We have 2 residency program, R1, R2, iteration 1 and iteration 2. Iteration 1 is the major big program in September, October, and the match result comes in March. So what are the requirements for the residency? Number one, the citizenship. Number two, proper degree. Number three, NAC. Number four, or I should say number three, QE1, and number four, NAC exam. These are the only four requirements, and you are good to practice in Canada. Okay, so that's simple, four step. Okay. Uh, Now, there are various stream in the R1 match or first titration. CMG, I will focus like IMGs. So IMG or osteopath from the US, they have the
I'm
stream.
sorry, I have a quick question. Sorry.
Sure, sure.
Relevant question is there any fast track for the physician to get the citizenship or not?
Citizenship, I cannot comment on this one if maybe somebody else, but for the doctors, there is no criteria and there is no priority that if I am a doctor in my home country, I will be given a priority in citizenship, if that is your question. So to be a doctor doesn't prioritize you in Canada to get the citizenship. So,
Understand. Thank you.
okay. And even passing the exam, it does not. But however, if you have some MRCOG, FRCS, there are 8 countries, Australia, South Africa, and those qualification, they do not write on the citizenship, but they do prioritize those because we need the specialist doctor anyway. So that is, but not for the general doctor like the MBBS level. Right. The CONS has partnership with the Medical Council of Canada. It also have the partnership with the Alberta and British Columbia program. First and second iteration, you can go to the CONS. Now I'm coming to a very interesting data. So we have in US match rate 58%. Wow. While in Canada, match rate is 33% for IMGs. Okay. So more than 9,000 IMGs were matched in this is the latest data from the US, 2024. While here in 2024, only 671 IMGs were matched. And if you compare this number with the Canadian medical doctors, that you will surprised that how many Canadian. So about 3,000 versus 671. That is the difference. The like you can say whatever is the challenge difference. So this is the difference. This is the real bitter truth. We have the total number match 3, and out of 3,618, the major chunk was 81% Canadian medical graduate and 19%, which was 671, was the international. So it means that we lack some knowledge which does not verify the CMG and IMG. This is the match by discipline. You can see the IMGs, they are maximum in family medicine, 205, and the minimum is the OBGYN, 7, while the CMG, they have very high in the internal medicine and pediatrics and the other. If you compare the IMGs and CMGs, you will see. There is a regular stream basically for Quebec only. Okay, so forget about. Now the last slide is that the changes we are expecting. They are hopefully good changes. That the duration will be shortened. The length of the exam will be shortened. So 6 hour, 1.5 hours short. Break time will be more 3 hours, less 3 hours. Sorry. Currently 4.5. Division, 2 equal part. CDM, there will be no more CDM in 2025. That's a good news for the doctors. Result, quick result, not 6-week waiting time, and the 4-year prometric and then content include the CTM. So the MCQ will also include the CTM component. I hope you enjoyed it, and I was in a hurry. so that I can deliver whatever I can do with you. And I will be with you in the next session. So you are welcome to ask any question.
Great. Thank you so much, Dr. Shakeel Ahmed, for an excellent presentation with tons of knowledge. And I know there were like lots of questions. And for anyone who would like to review this lecture or the slides, you can join the YouTube channel and then watch that later on. But now I will ask our panelists to please share their comments. And Dr. Shakeel, if I request you, please stop sharing your slides so we can have the full view.
Sure. Thank you.
Jose, can you start first, and then we can
Thank you
go
very
to the
much,
rest of the
Sarfraz.
panel?
And yeah, thank you, Dr. Shakeel. This is very, very concise, very comprehensive, crisp uh, overview of the situation. So we will move one by one. So because there's no question answer over there, so maybe we can move very quickly. First of all, from Dr. Professor Hamid Akhtar about his view as a practicing physician and a consultant. How do he see, the disparities between the US and the Canadian healthcare acceptance? And then we will move on to Professor Dr. Jabin about few words about the fellowship. So over to you, Dr. Akhtar Hamid.
Thank you very much. And it was really a nice presentation by Dr. Shakeel, giving an overall comprehensive kind of view what to do and what needs to be known. I would like to add before I move on to another, the question you ask is, while our immigrants or international medical graduates are here and waiting to be either clear their COMS application form or they are working on their QE1 and NACOSCI, they could or they should try to attach themselves with any family physicians or any other clinics to gain some experience of Canadian context experience, because especially in Ontario, it is hard to get the attachments in the hospital due to some insurance issue or some legislation issue that they cannot be entertained anymore. So any clinic can help you to get some clinical experience knowledge. And I'm happy to offer myself for that. Second point is, some of them already passed their exams and they have some free time. They should attach themselves to learn some clinical research and try to publish some articles. This will buy them some brownie point, and their application will look slightly distinct than with their colleagues, because there is a big competition and we don't have that much of candidates who have these kind of extra brownie points. Or they can register themselves in the master's program if they could, even as an online. Now, moving to your question is regarding the difference, is the size matters. If you look at our population and the population of America, so if you have any seats, say for example, pediatrician seats are say 30 in Canada, there will be 200 in America. Their residency programs have more openings. That's why one of the major issue that the difference here, and that's why the people go to, even the Canadians go to America to get their residency of their choices, because it is also very difficult for our Canadian medical graduates to get their residency. And
I
I'm
will
happy to
add
be, yeah, go ahead.
one thing, because I am working here. So here we are preparing our student about 1.5 year on the island exclusively for USMLE Step 1 examination. 1.5 year training for Step 1 examination, and then free rotation for all the colleges in Canada, in the US hospital, in all the hospital. But these two things are lacking in Canada. Okay, please continue.
Yeah, so that is what I was saying, that how to fill this gap so you can connect with the local community like a clinics. That will improve. And also these two things. I have been helping for the last 15 years as a voluntary research, volunteers and get their research published, even it's a garden newspaper. And this has given them help two things. One, they can have a qualify the COMS and they even match in Canada as well as in America. Even if they don't seem to qualify, if their age is more, if they have their graduation year was, say, for example, the old graduates, so they can have other professionals like it. They can become a clinical research assistant and then lab. So these are the main stuff I would like to add, and I'm happy to add more, but I know we have more panelists, so I would like to leave this here.
Thank you very much, Professor Akhtar. And now over to Dr. Jabin, please.
Yeah, thank you so much, Dr. Shakeel, for addressing this important issues of international medical graduate. I would like to comment on the FCPS graduates who can come for clinical fellowship, because I'm the clinical program director for pediatric emergency fellowship at SHAKEEL. So yes, it is a possibility that the FCPS is a qualifying criteria that you need to have a FCPS or any exam of your own country in that specialty if you want to apply to fellowships. I'm talking specifically about SHAKEEL, and I know there are many other places now are starting to offer these kind of clinical fellowship to address the physicians shortage in many specialties. So anybody who has an FCPS exam in their specialty in Pakistan is eligible to apply, and then they have to go through the whole process of application with some specific requirement and then interview, and then they will be chosen. But there is a possibility, and as everybody is happy here to guide, mentor anybody who has any specific question, want to come. During my fellowship, I have also helped not only from Pakistan, but also from other places to come and apply, to mentor and guide them. And I'm happy to continue offering that mentorship if any candidate or if anybody want more information, specific information for that. So I'm talking about the MAS, about the Canadian fellowship, not about the US fellowship. US, Dr. Shakeel can comment. In Canada, if you want to apply for a clinical fellowship, if you have an FCPS exam in Pakistan or MRCP or any exam, qualifying exam of your country, then you are eligible to apply for the clinical fellowship. Thank you so much.
One thing, thank you, Jabin. One thing I forgot to mention, that if somebody has recency of practice is not met, for example, 5-year-old graduate, the 5 year they are in the Canada. So how they can improve in the family medicine? There are only few institute, recognized institute in Pakistan. Fatima Memorial Hospital for the family physician fellowship program in Lahore, and in Karachi, Ziauddin Medical University. So make sure that you properly search that what program you are going to apply, and then go there back to your country, complete your hospital, and then come back. Okay, thank you.
Thank you very much.
So
Dr.
I would
Jabin.
like to add on one thing here. What with Dr. Jabin and Dr. Shakeel is, if from Pakistan, if somebody has done the fellowships like FCPS in internal medicine or pediatrics or any other like a medical side, we have helped them to directly get a staff post like in oncology department. So they directly working there. They usually get 250K job working as a staff physician under a supervised consultant, and that is also possible under this, like in Saskatchewan or Alberta provinces. In terms of if you are planning to come to Canada and if you're waiting for it, you rather get yourself, which Dr. Shakeel mentioned about Fatima Memorial and Ziauddin for physician, family physician, because in Vancouver, they go directly, and if they find after this physician training, they can go under supervisor and they can directly start working. They don't have to go through the entire residency program. I heard also the Dow Medical also started such program as well in the family medicine. Thank you.
Thank you, Dr. Akhtar. Now we have Professor Bhutta, Zulfikar Bhutta. So Waleed, can you open the mic for Professor Zulfikar Bhutta for his comment, please?
Well, thank you very much. First of all, let me say how useful and how important this entire session was, and I credit the presenters for making it, credible and simpler than to most people. I want to make 3 points. Firstly, most people coming to Canada should be not fresh graduates at that level, because as has already been pointed out, the landscape is changing and more competitive. But if you look at the future staffing projections for Canada, there is going to be a huge opportunity for particularly those people who are already FCPS qualified or have experience in specialty training, especially if you have a membership or anything other UK qualification of that kind. There is a huge opportunity, I believe, over the next 5 to 10 years of fast tracking into clinical appointments, because the next government and maybe this particular current government are both scrambling to fill some of the human resource gap. Many people don't know, but I can tell you that, for example, family medicine residency in Canada is only 2 years. So if you come into a family medicine residency program, in 2 years, you're out as an independent family medicine practitioner. Nowhere in the world is there a 2 years residency program. So there is a huge opportunity for people who are qualified to be able to come. But you have to come through the pathway of applying, getting an immigration visa or a work permit. And as Jabin have already pointed out, if you have an FCPS, there are some fast track pathways in particular provinces where there are shortages. Second point that I'd like to make is that there is now, as was pointed out, a very large body of Canadian origin students who have had all their education in Canada, but for medical studies are in the Caribbean. And that is a very large group that comes to Canada and competes against IMGs who come from other geographies. So that's one of the other reasons why competition is a lot tougher, because they are individuals who will at times get preference, and their standards in performance in examinations, as was pointed out by the worthy speaker, are generally higher. So that's the second point to recognize, and that's why I'm saying that maybe the pathway here that people should follow is to complete their postgraduate training in Pakistan, and then try and see if you can come through a pathway where you might be fast-tracked into positions. You may have to go to rural areas, but there's no harm in that, and there's much greater opportunity sometimes in those position provinces. The last point I would like to say is to support what Hamid was saying, is it always helps to have additional points in your curriculum vitae beyond just academics. So a well-rounded CV with maybe some research experience, or at least exposure to things beyond just bookish knowledge and exams, is an advantage. In the residency programs that I know in my own institution here, as Jabin would tell you at SHAKEEL, there are many residents who come into the residency program already with PhDs under their belt, and 5, 6, 7 publications on average. So you are going to be competing in a residency landscape with people who are older, generally, because the time it takes to complete medical education, more mature, and have had a vastly different pathway in their education, where they have been part of research and learning as part of their medical education process. So if you want to compete in that landscape, then please beef up your CV and experience in that way. And there are many, many medical colleges in Pakistan where I see students do this, and not just Aga Khan, but many other medical colleges where now students are very aware of that requirement if you are to compete in that landscape. So thank you very much. I thought this was very helpful, very useful. Thank you, Uzair, for organizing this.
All right, thank you so much.
Thank you very much. So
Thank you.
over to Dr. Sarfaraz, please.
Yeah, I know that seems like there are like tons of questions there. There's so many questions. I don't know, but the problem is that we already are 5 minutes past 1 o'clock, at least here in the US, which is kind of corresponding to maybe 5 minutes after 9 p.m. in Pakistan. So I think Dr. Zaid, the plan is to bring Dr. Shakeel again to have another session, maybe. Okay.
Yes.
So I think hold on to your questions, and maybe we can do a more of a interactive Q&A type session the next time with Dr. Shakeel, and to get to a lot of questions, and Dr. Jabin, Dr. Akhtar, and maybe Dr. Bhutta, if he is available, we can just bring all of them and have answers to these Canadian directed questions. So with that, I think we would like to end here, and I would like to thank our speaker, Dr. Shakeel Ahmed, for a wonderful presentation. for tons of knowledge, and for Dr. Akhtar Hamid, Dr. Jabin Fayaz, and Dr. Zulfikar Bhutta for providing the Canadian perspective, as they are all practicing in Canada. And of course, like always, Dr. Rozair and Dr. Sarwat Hussain for being the panelists and always being there, and Waleed and his team for the technical support. And of course, thank you to all the participants who have taken time to join and have shown interest. This lecture will be available on YouTube, and please stay tuned for our next in series, and we'll sure to bring Dr. Shakeel Ahmed back so that the questions that you have can be answered. So thank you, everyone, and inshallah, we'll see you back in 2 weeks.
Thank you so
Thank you very
much.
much. Thank you.
Thank you.
Thank you.
Especially
Assalamu
thank you,
alaikum.
Dr. Bhutta.
Yes.